last week or.
Hey, we got a quick pour breaks.
Oh, okay, good. Is it working?
Yeah, we'll go quick pour
Now it's
breaks.
working.
Pour breaks.
Okay, here we go.
Hey, this is Dr. Buzz with Buckeye Physical Medicine and Rehab. BuckeyePMR.com is the website. I'm here today with Tiffany. What's up, Tiff?
Hey.
She's wearing her hair down. And Jim's not sweating
It's
today.
important.
But she's my operations director at Buckeye, so she's been with me for how many years?
6.
Yeah,
going on 7.
Days. Yeah, sorry. But we're going to talk about some of the stuff she does with Buckeye. She also has her own business. Not that working for me is not enough. Botanica 215. We're going to talk about that a little bit. And some of the programs we have at Buckeye. So it'll be a loaded show. So we're going to cut the break and we'll be right back.
Ready?
Ready. Hey, this is Dr. Buzz. I'm back with Buckeye Physical Medicine and Rehab. BuckeyePMR.com is a website. Check it out. I'm here today with Tiffany. What's up, Tiff?
Hey.
And today, Tiffany's been with me for, we said, 5 or 6 years?
6 or 7.
6 or 7 years, give or take. And she basically runs all the behind the scenes at Buckeye. I'm not good with that kind of stuff, and she's the best at it. So you started out doing what? You were working as a floor therapist?
A million years ago, yeah.
Yeah. You moved from that, now you did front desk. You've done every position at Buckeye pretty much, and you can do any position.
Pretty much, yeah.
And you've been there for the changes. So you were there when you first came. Were we medical then? I don't think we even had medical.
We were chiro and PT centers.
Yeah, so we're chiro PT centers. So you've kind of seen the evolution of things, of the company as time's gone on. And you also helped me out. We also help integrate other practices like ours with a company called MedFusion, which she helps me with that stuff too. So had a lot of good times.
Yeah. A lot of traveling, a lot of fun.
And then, if that's not enough, then Tiffany also has her own business, which is Botanica 215. We're just trying to figure out the name, though. So let's talk about the name first. What is Botanica 215?
So Botanica is kind of reference to the botanical lifestyle that we have. So we deal with fresh cut flowers as well as plants. Our shop does primarily plants, things like that. But then the B215 side is the wedding consultation, and we do all of the design work for weddings. So
and that's kind of like what you focus on, right?
Yeah, that's
weddings.
Primarily. Our weekends are what flies.
And then what do you do? So then if someone wanted to get a hold of you, how does that even work?
So our website's probably the best option. We're at botanica215.com. And we have request options, as well as we have like orders online. We can do everything on there. You can do like recurring orders, things like that.
And can people see what you've done? Like, do you have pictures on there or something?
Yeah, it uploads everything that we do on Instagram as well.
Oh, very cool. So Botanica 215, if you have any floral needs, in particular weddings, right?
Yeah.
Or company things or whatever like that.
Yeah.
And then what's up with the 215? Right? We're going to talk about the 215.
So that's the address that we're on. So we're 215 King Avenue. And then it also correlates with 215, which is the shop that we worked at previously. We met when I was like 16 years old, my business partner and I, Becca. And that was actually the store number as well. So it was kind of serendipitous that both things were 215.
Very cool. So you've had the same partner the whole time?
Yes.
That's cool. And you guys how many years have you been doing this?
We've had Botanica 215 for 2.5 years now, but...
You were doing flowers before that,
yeah,
though.
way before that.
How many years?
Since I was 16, so over 10 years.
Yeah, that's awesome.
We won't
And they do really
awesome.
awesome stuff. So but check out Botanica 215. And as I said, you work full time for me, and this is like something that but then you just work all the time. How many hours you work in a week?
Yeah, I'm working a lot.
Yeah. But because you're with me for at least 40 hours a week, if more,
we'll call it on call as the rest of it.
And pretty much, and we're busy. Last year we saw almost 80,000 patient visits, so there's lots of. We have like 70 plus staff, I think.
Yeah.
You probably know better
this
than
year
me.
a little bit lower. I think we're at like 60 this year.
So it's just lots of staff issues, lots of patient stuff going on, but all good stuff. But that's obviously requires a ton of time, and we're always doing new programs too. And what our vision at Buckeye, when I first started Buckeye, it wasn't Buckeye. It was a chiropractic office. And chiropractic works very good for musculoskeletal pain, back pain, neck pain, shoulder pain. And after doing that for a few years, I realized, PT also helps those type of injuries. Sometimes PT is better, sometimes it's not than chiropractic, but PT mixed with chiropractic works amazing. So, I went and I tried to find out the best PTs I could and brought PT in addition to chiropractic. That way, when someone got injured, they didn't have to think, should I see a chiropractor or a PT? We had them both under one roof. And we were doing the chiropractic PT thing for a few years, and we realized that, medical is really good too. You could, we're referring medical out, but, sometimes when we refer out, you don't know the quality you're going to get. So that's what they, thought, well, if we already have PT and chiro, let's bring medical in too. And in the meantime, we had massage, so we already had, so we had PT, chiropractic, massage, and we brought medical in, and that way, once again, the big thing, the thought process on this whole thing is when you get injured, should I go see my massage therapist? Should I go see a chiropractor? Should I go see my medical practitioner? Should I go see a PT? That takes the thought out of it, because when you come to Buckeye, you would end up seeing probably all three of those or all four of those providers. And sometimes you might just need chiropractic, sometimes you might just need PT, sometimes you might need the whole gamut. Depends upon what you got. But each and every patient that comes through, even to this day, we have a meeting. So the staff literally sits down with every patient in their file, and you'll have the PT, the medical staff, the chiro, and the massage in the room together, and talk about that person as an individual and what modality or modalities would help them best. And then something that, we were doing all that stuff, and then we realized there were still some patients not getting better. So even though we're doing the best medical care, best chiropractic, best physical therapy, some people, their injuries kept coming back, and or they weren't recovering like we should. And I think we all would agree, as we get older, we don't recover like we should. So we knew there had to be more, and that's when we started doing hormones. Because I know we talk about in the show often, if you're hormone deficient, if you have low testosterone or low estrogen or low growth hormone, it doesn't matter what type of chiropractic or PT or medical procedures you do, you won't get better. Or worse yet, the injuries will continue to come back. And that's what happens as you get older. And the cool thing is, with bioidentical hormones, you can safely and effectively heal like a young person. It's pretty crazy. I mean, and you've seen that, right?
Yeah. It's my favorite program. You can see the fastest success, I'd say.
Yeah, I mean, and you deal with a lot of those. I know, like, you'll fill in, and the satisfaction on hormone patients is what?
It's beyond, I would say 100% for the most part, as long as you're following the directions.
Yeah. So there's very few patients, if ever, that have been hormone deficient that we put on hormones that weren't static. Would you agree with that?
I agree, yeah.
So, and it's one of those things people, ask, like, certain people say take this vitamin or that vitamin, and they may or may not be good for you, right? But when you take a vitamin, you really don't notice it. You just kind of take it. You take vitamin C because, you heard it's good for you. So, I take vitamin C, but I can't say I feel better when I take vitamin C, right? Right. And we all take vitamins, or CoQ10. I take ubiquinol, which, research shows is good for you, but I can't honestly say when I take it I feel better. Your
joints feel amazing.
But with hormones, it's one of those things. If you're deficient and you take hormones and you do it properly, like we do at Buckeye, in 8 to 10 weeks, it's a night and day difference. So it's not one of those therapies you're going to do and say, man, I just do it because doc told me it's good, but I really don't feel it. It's night and day, and that's the cool thing about it, And what happens to males and females is hormonal decline is fairly slow, especially for males. Guys, lose testosterone 3 to 5% a year. So it's kind of like a boiling frog. Do you ever hear the boiling frog analogy?
No, what is that?
Well, not that I've ever done this, by the way, but if you put a frog in hot water and turn it up, they don't feel the difference in temperature, and you can boil them and they'll be dead before
they realize the temperature.
Yeah, that's what a boiling frog is.
That's insane.
I've never done it. I don't like frog legs either. But anyways, but that's what happens to the guys. So your testosterone decreases until one day you wake up, you're 45 or 50, and you're sitting on the couch, and you realize what the hell happened, and that's what happens. So, and the point is, don't wait till that point. If you're listening to the show and age doesn't matter. We have a lot of guys that even their 20s that have low T because of stress and other environmental factors. And if you're listening to the show and you lack energy, lack libido, aren't motivated to go to the gym, have aches and pains everywhere, just don't feel good or feel depressed, get your blood work done. It's real simple. Most insurance covers it. If not, you can get your testosterone checked for $35. Get your blood work done and see what your levels are, because if you're testosterone deficient, you don't have to suffer. And the other thing, the crazy thing I see in our office all the time, I actually had a psychologist that came in yesterday. It was pretty cool. And we were talking, he came in from Toledo, and we were just talking, and we were kind of going over the symptoms, and he's like, those are all the symptoms of depression. I'm like, exactly. And he goes, I wonder how many of my patients are on depression medications that just have low T. I was like...
It's a crazy thought for his practice.
Yeah, so... And that's true, and I see it a lot in our practice. Guys will come in particular guys that are, these physicians. A lot of physicians have this impression: if you're not 40, if you're younger than 40, there's no way you can have low T, which it makes no sense whatsoever. So when you go, so people will listen to the show and they'll go to the, and I've heard this a million times, not a million, but a bunch. They'll go to the doctor, hey, I've listened to this show, or this doctor, he said I might have low T, can I get tested? And the doctor literally won't test them. They'll look him in the eye and say, listen, you're 35 years old or you're 28 years old, there's no way you have low T. You probably have depression. Let's put you on some Wellbutrin or some other type of garbage. Instead of doing a stupid blood test, right? And that drives me crazy. So take your health into your own hands. If you're suffering one of those things, a blood test is real simple. And if you don't have, people come to our office, I tell them, if you're not hormone deficient, we're not putting you on hormones. So if you're fine, and some people come in and they're fine and they do have depression, and that's a separate thing. But before you get on depression medication, why don't you get your blood work done? Because, obviously taking any type of medication that messes with your brain chemistry is not a great idea, right? Unless you have to. I mean, if you have to, you have to. But if you don't need it, I know it's bad. And you simply, get your blood work done.
Fix the problem.
Correct. So, if you're listening to the show, even Jim here, who's not sweating today, I had to be on the show for at least a year. He finally got his blood work done, and we got him hooked up now. So we're just looking for a girlfriend. But he's kind of cute. Do you think he's kind of cute?
Sure.
All right. That's radio, so you can see he is kind of cute. Anyways, all right, Tiffany. So tell me, day to day, as you can see him on Facebook, he is eligible, and he lives close to work. So you deal with a little bit with hormone patients. You said that's your favorite program. Why is your favorite program?
I like to see the success. I mean, you said 8 to 10 weeks. Usually guys are feeling better by 4 to 6 weeks, and they're telling you about it. So it's really exciting to hear the enthusiasm. They're like, I sleep so much better. I actually sleep 6 to 8 hours, and I am feeling motivated to go to the gym. Like, it's insane to see the difference. So that's why it's my favorite.
Yeah. And I think that's another thing people don't take into consideration. One of the first signs of hormone deficiency is difficulty getting a good night's sleep. Now, that doesn't mean you're tired and you can't take naps, but difficulty getting a full night of sleep. And a lot of people can't sleep a full night.
They don't even think about it. That's the crazy part. And then you start mentioning it, and then they notice it, and they're like, oh my God, I wake up 10 times a night or whatever. Yeah,
and the problem with that is if you don't get a good night's sleep, it affects your growth hormone levels, which affects healing and cardiovascular health and lots of other things. Low growth hormone levels are directly related to heart disease. And if you're not getting good sleep, you're not going to have good growth hormone levels, and you'll have lots of injuries and other stuff. And it affects your metabolism to some degree. Because if you're too tired to go work out, and, I preach all the time, everybody has to exercise at least 5 days a week. Now, that doesn't mean going to the gym and squatting 300 pounds or running a marathon, but that means something. Go outside, a walk, ride a bicycle.
At your work or do whatever.
You have to move. If you don't have the energy to move, you're dying. It's that simple. Like, everyone has to exercise. I don't care what age you are, 20, 30, 40, 50, 60, 70, 80, 90, 100. You have to keep moving. That keeps your body going. And if you don't have the energy to do it, very likely it's hormonally related. It's not that you're getting old. Saying you're getting old so you can't exercise, you don't have energy, is like saying you're big boned and you can't lose weight. It doesn't even make sense, right? So
it's a made up condition.
Correct. So if you're listening and you used to work out but you don't have the energy to work out, or you have aches and pains so you can't work out, get your blood work done for sure. And another thing we do at Buckeye that we're very proud of is we have a medical weight loss program. And obesity, 35% of the population is clinically obese, so it's a problem that a lot of people have, and it's because of the lifestyles we live in, all the processed food and all the garbage.
And just how uneducated we are with that system in general.
Yeah, I mean, and I see it even. I went to I've been running around all morning. My kid had breakfast with like you go to school and have breakfast with your kid. I don't know what they call it, like breakfast with your kid.
Parent breakfast, who knows?
So we go there, and all they have is donuts, which there's nothing wrong with that. But then a bunch of the kids are just big, and it's sad because, what science shows us, if you're big, by the time you get into puberty, all your fat cells are there, and then something you're going to struggle with the rest of your life. And obesity is the number one cause of preventable death. That's obesity and its comorbidities. Because obesity leads to, certain types of cancers, cardiovascular disease, arthritis, pretty much any condition you can think of is accelerated and aggravated by being obese.
A lot of the conditions that we treat are exacerbated by obesity, so
yeah,
we see it all the time.
And if you're obese, your knees are going to wear out quicker, your hips are going to wear out quicker, your back's going to wear out quicker, and you can't, physical therapy and chiropractic your way out of wearing out your joints if you're obese. It just doesn't work. So, one of the things we've had really good success with is our medical weight loss program. I'm really proud of it because people literally lose, 5, 10 pounds a week on the program if they follow it, properly. You have a coach. But we address the root cause of it, and number one, any diet that you're buying shakes or bars or stuff like that isn't sustainable. And our diet's sustainable. We teach you how to eat properly. You have a coach. You go to the grocery store and buy your food. We don't, prepackaged meals or anything, which saves you a bunch of money. But we give you a list of things you're allowed to buy at the store, and then the foods are good too. You did it, right? Did you do that?
Yeah, I did a modified version, but yeah, I definitely tried it out.
It's not hard to do. The diet's not hard. No,
and it's nice because it gives you recipe options, and it gives you the basis of what you can eat, so you can always work around and find other recipes that fit that. So it makes it easy.
Mm-hmm. And you super. What kind of results have you seen with people on the weight loss program?
Huge. We've had people lose up to 60, 70 pounds for the program.
Yeah, and the way I like to judge our program is there's lots of diets where you can lose weight, but keeping the weight off. And I think we've done a really good job, or our patients have done a good job, I should say, of keeping the weight off because it really changes the way you eat. When you're eating healthy, the core of the program is 42 days, I would say. And so the 42 days is pretty hardcore. You're eating, vegetables, lean proteins. But, over those 42 days, you break your habit of eating garbage.
And usually you withdraw from sugar, all the things that you constantly crave. Correct.
And, and people don't realize that when you're losing weight like that, too, all your toxins are stored in your fat, too. So when you're losing fat like that, you're detoxifying. And the other thing that people don't realize is fat cells metabolite inflammatory enzymes. So if you're obese and you have a lot of fat, you're always going to have aches and pains.
Right.
And it's not only because of the weight and extra weight on your frame, it's because of the enzymes they release, and it actually causes inflammatory processes in your body.
Right.
And inflammation obviously causes aches and pains, a lot of stuff, but inflammation also leads to clotting of your arteries, can lead to Alzheimer's disease. These are all inflammatory, COPD. These are all inflammatory processes. So anything you can do to reduce inflammation in your body, which losing body fat is one of the best ways to reduce inflammation, it's not going to help you feel better, but it's going to help you live a longer lifespan.
And on top of that, we add extra medications like probiotics, things like that to help your body process everything. So you're functioning better by the time that you're leaving that program.
Yeah, and probiotics, what she's saying there is anyone who's ever taken an antibiotic, which in today's world is pretty much everybody. If you take an antibiotic, you kill off your body's normal bacteria and flora. So when that happens, you develop this condition called a leaky gut. And basically with the leaky gut, what happens is, basically toxins like gluten directly seep into your bloodstream and cause all these autoimmune conditions, watery eyes, runny nose, skin outbreaks, all this stuff. But it all circles back to the antibiotic you took. You didn't take the acidophilus afterwards or probiotics afterwards. So if you're listening and you or your children have ever had an antibiotic, immediately following the antibiotic, you've got to take acidophilus or probiotics. And all those they're usually a capsule you take that restores a normal flora. Very, very, very important. And anytime you take another antibiotic, as soon as you're done, take the probiotics or the acidophilus. And don't take it during it, because if you take acidophilus or probiotics, when you're taking an antibiotic, you're just going to kill it anyways. So you wait until you're done with it, and then you do it. So, but you'll notice a big difference in the way you feel, the way your immune system works. Your allergies will get better. Everyone in today's society suffers with allergies. Well, everyone takes it, don't say everyone. Most people take lots of antibiotics. Most people eat a bunch of gluten and garbage, so they have these leaky gut, and they get sick all the time and have all these allergies. It's not that you're allergic, it's just you're hypersensitive because of the leaky gut. So it's something that's really easy to avoid.
Right.
So we're going to cut the break, and I'll be back with Tiffany from Botanica 215. You press that, mess it up.
All right. I don't think they saw me on there.
I'm gonna hook you up. Don't worry, I'm hooking you up. That's my goal.
No, and I'll be on Buzz's show as soon as the hormones start kicking in full time.
Gotta get a girlfriend first.
Run the board.
Yeah, I'm going to be on the show and run the board. I'm just going to.
What if we win a date with Jim
sure.
for the?
No, win a date.
That's a great idea.
No.
Challenge.
Oh, you win a trip with Jim?
Yeah.
No. I'll be on the show with him, like December or something. I'll be on the show with you after the hormones are fully kicked in and talk about how much better I'm sleeping and things like that.
Oh, you won't be sleeping.
I don't want to wake up 5 or 6 times a night anymore. I'm tired of that. Okay, you ready?
I'm ready.
Here we go.
Hey, this is Dr. Buzz. I'm back with Buckeye Physical Medicine and Rehab. BuckeyePMR.com is the website. I'm here with Tiffany of Botanica 215. That's her side job. Her main job's working with me, but we are talking about Botanica 2 today. But we're just talking about some of the things we offer at Buckeye. We talked about hormones. That's her favorite. And I would probably agree that's the most satisfying because everybody feels better. Everyone, guys and girls, feel better on hormones, so that's easy. Obviously, people with back injuries and shoulder injuries, we have really good results, but hormones is 100%.
No.
So it's whatever. I mean, nobody who's hormone deficient that gets on hormones doesn't say they love it. So that's easy. And we didn't talk about girls at all, but girls are the same as guys. The only difference with girls, I'll say, is twofold. Number one, guys' testosterone decreases 3 to 5% per year, so we're like boiling frogs.
Got it, frogs now.
Where girls are different. Girls usually are great, and then until they hit this thing called menopause, and then they fall off a cliff. So they, go from that. They don't have 3 to 5% a year. They go from 100% to 0, which that's why menopause is terrible.
He reminds me constantly how I need to be aware of it.
Yeah. So but you'll know. So, and usually for girls, I say as soon as you have hot flashes, you need to get on hormones immediately because when you're having a hot flash, that basically means your body is quitting producing estrogen. And the problem with that for girls in particular, and if you ask me what's more important for guys or girls to be on hormones, once again, I feel everybody should, and you're crazy not to. But if you had to pick, it's more important for girls than guys. And the reason for that is girls need estrogen. And they quit producing it and have zero estrogen and testosterone and progesterone once they hit menopause. And the problem with that is estrogen receptors shut down with time. So if you're a female and you're starting to have hot flashes and you decide you don't want to do hormones, and you come back when you're 70 or 80 years old, it's not that it's too late, but you'll never get the results just because the receptors shut down. So you'll never be able to absorb estrogen like you used to. So for females, it's essential that when you start going through menopause, you get on hormones as quickly as possible so you don't lose any of the estrogen receptors so you can look young and feel great the rest of your life. And estrogen is what makes a girl beautiful. That's their skin and their hair and their curves. You can't keep those. Can't keep your nice skin and hair and your curves if you don't have estrogen, and you won't have estrogen if you don't do bioidentical hormones.
Is there anything that you can do before menopause?
Well, some females do start to go decrease earlier in age, so you don't have to wait till you have hot flashes. So if you're suffering in the same thing, depression, difficulty sleeping, low libido, no mental focus, those are signs that you are decreasing. So once again, come get a blood work done. If your hormones are fine, we'll let you know, and if not, then you don't have to be menopausal to do bioidentical hormones. You can start earlier. Just usually for girls, it's right around that time, but not all the time. And then obviously, if you've ever had any type of surgery on your ovaries or uterus or anything like that, that complicates everything, and that's another good indicator that hormones might be a good choice for you. But once again, get blood work done. The blood work never lies. And the other thing you have to keep in mind too is you have to have estrogen for joint health and bone health. There's an epidemic of females with osteoporosis in this country. Well, if you're a female and you're not on hormones, you're going to have osteoporosis. It is what it is because you need, estrogen controls osteoblastic activity, and what osteoblasts are in your body is they reproduce bone and cartilage. If you don't have estrogen, you don't have osteoblasts, you don't have healthy joints and healthy bones. So that's your only hope. And one thing that kind of stinks for females is a lot of females are afraid of hormones. And the reason they're afraid is, they hear about, their friends have taken, Premarin and Provera, the two that come to mind, but there's lots of other drugs out there that mimic hormones, but they're not hormones. And unfortunately, the way medicine works is you're a female, you start having hot flashes, you go to your doctor, oh, you need some estrogen, we'll give you estrogen, and they'll give you Premarin. Premarin's not estrogen. Premarin's a drug that mimics estrogen. It's a synthetic. The body recognizes that, and that's why it causes cancer and strokes. So if you're taking Premarin, don't take it. It's bad. Read the back of the label. Same thing with Provera. Provera is not progesterone. It's a drug that mimics progesterone. People will ask, well, why wouldn't my doctor tell me this or give me this? Well, you can't patent a naturally occurring substance. You can't patent bioidentical testosterone. You can't patent bioidentical progesterone. You can't patent bioidentical estrogen. If you can't patent it, Big Pharma doesn't want it. So the sales reps won't come to your doctor's office, so you're just not going to see it. That's why these other medications, they're not even hormones, they're medications, are out there, and they're not safe and they're dangerous. And for guys, the same thing. Guys that have heart disease or heart conditions need testosterone more than anybody. And people will say, well, I thought testosterone can cause heart disease. Well, it doesn't. It helps prevent heart disease. Now, but what happens is testosterone gel in guys can, because testosterone gel in guys produces a bunch of estrogen. That's why it makes no sense for guys to use gel. Testosterone gel for males could and would cause heart disease, so it doesn't make sense. That's why we don't do it. But if you've had heart disease, if you've had any type of health condition, testosterone or bioidentical hormones will help you for sure. So, anything you want to add? You're quiet and your hair's done. And Jim's not sweating.
We have to talk about my hair being down because that's not normal.
No, she's working hard all the time. So, Tiffany does an amazing job with me. She also has her side business, Botanica 215. Trying to help her a little bit there. So, once again, so if you have a wedding coming up,
yeah, we're actually booking for 2018 and 2019.
Jim will probably be using you this year too. Once we're gonna get him married off for sure.
Yeah, I believe it.
Okay.
Win a date with Jim.
We're on a
right?
mission. Win a date with Jim. WinADateWithJim.com.
That's not real. Don't look that up.
Yeah, never mind. Don't look it up. But you can look up Jim. But anyways, go to your website, check it out. Once your work's there, you guys do some amazing work. And pretty cool little store too.
Yeah, it's fun.
Yeah, it's cool.
To come in a terrarium or something.
But I do appreciate you coming on here today. Check out Botanica 215 and check out our website, BuckeyePMR.com. And until next time.